Rogers Behavioral Health, this is Tabitha. I'm currently the Regional Admissions Supervisor. So we would first want to do an over-the-phone screening. When I started at Rogers, I was doing a little bit more clinical work as a residential counselor in the Eating Disorder Center. Kind of found my way to the administrative side and started working in admissions. When Tampa opened up as the first regional, I decided that I wanted to move to Florida, so I had an opportunity here to work in admissions and utilization review. Just having supervisors and managers and directors who want people to stay within the organization. Rogers is open to having you kind of explore whatever path you want to go down and really just help you get there.
I really enjoy the different treatment modalities that we use. I really like that they're evidence-based and you can see them working with all of the patients. Mainly because we have patients here Monday through Friday, every day throughout the day, working on exposures, working on behavioral activation, working on CBT. You don't really see that at a lot of other places. Some places they only see them a few times a week or maybe even once a week. Here at Rogers we see patients Monday through Friday, and that really allows for you to be heavily involved in their treatment plan but also heavily involved in their recovery, and I think that's amazing.
When we're training staff, particularly staff who work in the what we would call the common area, the lobby out front to check in patients, that it's important to remember that many times, most times, when people come to you, particularly the first time, it's possible they're having the worst day possible in their entire life. And it's very important to remember that it's up to us to let them know that they're being supported. We have a group of people here who are very dedicated to making sure that everybody succeeds, which makes us a fantastic place to work.
The difference here with Rogers as opposed to other places I've worked at is specifically just the family feeling. I feel like I have a supportive family here. Any issues that I have, any concerns, I can even go to the doctors for support, clinic supervisor, and my coworkers are just my daily family. So I leave home from a family and come here to work for a different family.
The best part of my job would just be kind of talking to people, getting to know them, watching them get better, being there when they most need you. Yeah, because a lot of people, they're opening up to you and they're being vulnerable. So, you get to be there for them, be that person who helps them through it.
I think if you have the passion, then it's absolutely the best place to work. I've had the opportunity to work at different hospitals and like psychiatric units and again residential centers and day programs, and this by far is not only the most impactful but what works, and it's just, I feel it's a blessing to be here doing this because it's just such a immense responsibility, and I take that part of it very seriously as well.